Good morning, everyone. My name is Jill Applegate, and I, along with Sheila Hansen, am the co-chair of Iowa's Children's Policy Coalition, a group of over 30 state-based organizations that are working to raise the profile of children during the 2020 caucus and presidential election. We are excited to welcome Montana Governor Steve Bullock to our conversation this morning. And I just want to quickly say thank you to the staff of New Horizons Academy who are graciously hosting us here this morning. So Governor Bullock, if you'd like to tell us a little bit about yourself and why you decided to run for president.
Yeah, and great. First, thank you for the work that y'all do as a coalition to bring people together to really focus on these issues. I'd say that, I've been 10 years in public office now. First I was Attorney General and then Governor, but the most important job I probably still have is being a parent. A 17-year-old daughter, a 15-year-old daughter, and a 12-year-old son. And I recognize that, as I think you all do, that on the day we're born, it's a lottery of life. We have no idea, and a child never chooses their parents, and every parent does as well as they possibly can. But the supports that we can give our children from actually even maternal support all the way is going to shape those opportunities at every single step of the way. And the lottery of life is, no matter who our parents are or what their economic background might be, that by and large they try to do their best. And I think that government has an obligation and an opportunity to actually provide those supports so that every child has a fair shot at a better life. Real quickly on my background, raised in Helena, Montana, single-parent household, only knew there was a governor's house in town because I delivered newspapers to it, so I've made it like 4 blocks in life from where I was raised. But also had a quality support systems even before entering into the K-12 system. And had a mom that would spend a lot of time reading to me and my older brother. And we always had both, I think, our physical and emotional health taken care of. But then it was a quality public education system that allowed me to come to where I am today. And I think that throughout my time in service, which we'll talk a little bit about both looking backward and looking forward, the recognition of that we all have an obligation to make sure that the policies that we're putting in gives every child that fair shot at this notion of whatever this thing called the American dream is. And I think that there's a lot that we can do and a lot that advocates, as you work on these issues every day, not just during a presidential election, but also in your state houses, can make that meaningful difference.
Oh, wonderful. We're so thankful to have you here this morning, and we're going to start. We've got 5 questions we'd like to ask you on a variety of topics related to kids and families. So I'm going to first turn it over to Emily Harris.
Hi, Emily with Every Child Matters. I'm a mother to a 6-year-old, and when I had Lennon, I was still in school. I went through college with her, going through changes within the Medicaid system because as a single mother, I wasn't able to work a full-time job and go to college so that I could put insurance on her through myself. And while all that was happening, she was born with a pre-existing condition. She has a heart murmur and she had problems with her lungs. And because of that, we always had to stay on top of the Medicaid changes. As you may know, we have managed care here, so there's multiple times where my biggest stress was not my exams, it wasn't giving my presentations, it was making sure that my daughter had the health coverage that she needed. And through that, now we also, with the pre-existing condition, there's only one provider in the state that will see her. There's only one pediatric cardiologist, and we are lucky enough to live in Des Moines where that pediatric cardiologist is. But for many kids, that's not a reality. They don't even have that coverage. We're not unlike most families. 49% of Medicaid and Hawkeye enrollees in Iowa are children. So as president, what actions would you take to ensure that all children have health coverage and receive health services that meet their needs?
Yeah. And Emily, the experience that you've had with your child is all too common, right? I think of my youngest is 12. He had a heart attack and he had PPHN, right? Within 24 hours of his birth, he had a heart attack. And ended up life flighted to Primary Children's Hospital in Salt Lake for the first month of his life. And because we had both the care that we had and quality coverage, now he's a running back on a 7th grade football team. And that's what every parent wants along the way.
Right.
And it's both the physical and the mental health, right? And we should probably touch on some of that as well. Like, we look at, in some ways, the biggest strides for healthcare overall really was, since Medicare, was the Affordable Care Act. That's the biggest move we had made in 50 years. And from my perspective, we need to build on that, not start all over, because of things like pre-existing conditions. And we've had Republicans try 70 times now to repeal the ACA. And that impacts every person and every child with pre-existing conditions. But what example? About 90% of people are covered by some sort of health care right now. That doesn't necessarily mean it's quality care. The other 10% we could get if we actually could expand Medicaid to those states that haven't. If we could then auto-enroll people into an exchange. And then I think we have to deal with the overall cost of health care. I'd propose a public option. It's crazy that we pay more for prescription drugs than any country in the world, and we can't even negotiate those prices. And in some of the out-of-network charges, surprise medical billing. But to exactly what your point is, and the challenge of a child along the way, I think that there are two different things. One of which is some sort of predictability and certainty in Medicaid, in the Medicaid program. What I've seen in your state relative to my state, where you've privatized Medicaid, it's not the best way to go. Now, the federal government can't set all the parameters for every state, but we know, for like example, in my state, we also cover vision and dental. And few states in expansion population cover dental. Well, if you can't take care of some of these basic needs, you're not going to get everything else along the way. So building and never going to like a block grant for Medicaid, because that requires you to take further and further services away along the way. But providing Medicaid expansion, because it's not only important for the children, it's also important for the communities. When you have 20% of our rural hospitals at risk of closing, as you say, you're lucky because you're expert. You live in Des Moines, but if you lose a hospital in a rural area, you're going to lose that community. And so many of the times it is that base funding issues. We had reauthorized CHIP in 2018. And why it took so long and extensions when we're providing this base health care is beyond me. Like, we need to make sure every child is covered. I think another area that I touch on too, so part of it is making sure that you always have a doctor you can go to. And that's especially difficult in rural areas. So we also have to figure out ways to be providing greater reimbursement areas for our rural areas than even our urban areas. We have to have a quality Medicaid expansion, and I think a public option that you can buy into. But then I'd also say that often we're looking at the physical health and not necessarily all the facets of mental health. And we need to be able to address that from birth on as well. I don't know if you guys have done much work in adverse childhood, the ACEs. Like, we're now rolling out all throughout our 1st through 5, the PACS Good Behavior game, because building the resiliency, because that's one of these evidence-based programs that have been demonstrated to actually impact the ACEs, the experiences that you have along the way. Long way to say that I think that every child should be covered by health care. And I think that there are real disparities between states. And there ought to be some baseline threshold, but then also we have to make sure that you have a decent provider network and it is affordable.
Thank you.
Yeah.
Next, we're going to talk a little bit about early education and childcare. So I'll turn it over to Jillian.
Good morning. I'm
Good morning,
Jillian
Jill.
Herring with the Iowa Association for the Education of Young Children. And Iowa has a child care crisis, much like all of the states in the
Yeah.
United States. I don't know that there's any that are exempt from that. We have lost over 42% of our providers in the last 5 years. And we have people leaving the field because they don't make enough money.
No.
but parents can't afford childcare either. Childcare costs here, just like the other states, is equivalent to a college
Tuition.
education per year. And there's no loans for that, and we want, as you mentioned earlier, to give everybody the best start in life and keep them ready and on target to start school. What will you do as president to make childcare more affordable,
Yeah.
but also to ensure that people working in childcare have a living wage?
You bet. Yeah, and so I told you my oldest is senior in high school now, and she was the first day, our first year of full day kindergarten in Montana. And I'll never forget. So, the guy, Mr. Wolf, was her teacher and was kind of a legend in Helena. He taught 4 of my wife's siblings, and he could, he said, I can do so much more with these kids now. But for so many children, their path is already defined. And how can we say at 5 years old, your course is almost set, right? But we know that 92% of a child's brains develop before they even enter kindergarten. If you're not at kindergarten ready, half likely to be at grade level by 3rd grade. If you're not at grade level by 3rd grade, 4 times more likely to drop out. So probably the best investments that we can make along the way to really set up a child for success is that pathway even before they ever enter into our kindergarten, our public school system. And that's exactly with both quality child care and with early childhood education. To your point, Jillian, like we had a publicly funded pre-K program in a town, and when we lost funding for it, they said the closest even daycare provider is 30 miles away. So especially like in rural areas, right, that it can be such a significant. And parents having to choose, if they can make the choice of saying, well, if I don't have a quality program, I can't be in the workforce along the way as well. And then there has to be standards of quality along the way. I think that there are things, and this is where the federal government really ought to be stepping up. And I propose universal access to a pre-K program. And it has to be a quality program from the perspective of, we know what happens in an evidence-based perspective. This isn't trying to start, school when they're 3 and 4 years old. What it's doing is giving them the tools so when they show up, they have those basic emotional and social skills to really be prepared to learn and have their whole life change. A Head Start teacher, though, at least in Montana, often makes $14 an hour at best. And this is somebody, a degree, it substantially can be different if you're in probably hopefully a center like this. So there are parts of along the way, if we're going to make universal access to a pre-K program, and we have the expectation that there will be qualities of standards and we have to be paying like other educators. I think that in part can come from the federal government dollars coming in. It's not just, I guess, a pre-K program too, because quality child care and daycare begins at that age, right there, right? And so I do think that, you look at, there are federal dollars to help augment, like in Montana, it's the STARS Best Beginning program, where we'll go in, we'll provide opportunities to try to build up every daycare center, public and private, and provide some funding. And we have to provide on a sliding income scale the access to a quality daycare program, no matter who you are. But I think that probably the most important investment that we can actually make when it comes from an education perspective and from the federal level, because the federal government's not going to pay for all of our K-12 system. We never have. But the federal government can make those meaningful investments, both in Head Start, but augmenting so that we have universal access to pre-K. At least from my perspective, that's what I propose to do.
Denise is going to talk about children's safety and well-being.
Hi, Denise Rathman, National Association of Social Workers, Iowa chapter. And child safety there's a lot of different facets to that.
Yeah.
First of all, we've got violence in the classroom, sometimes perpetrated by adults and sometimes by their own classmates who are dealing with behavioral health issues. Just recently, we had a boy here in Iowa who was tried as a youthful offender in adult court on charges of attempted murder. According to the Brady Center and the National Association of Social Workers, gun injuries sent 75,000 children and teenagers to emergency rooms over a 9-year period. That cost was at $3 billion. Bullet-inflicted injuries can be physically and emotionally devastating, especially to children and teenagers. Other types of violence include a child is abused and neglected every 47 seconds in the United States. The annual total direct and indirect cost of child maltreatment is $80.3 billion. That's in 1 year. America's most vulnerable children are those who have been placed and abused and who have been abused and neglected, removed from their families, and placed in foster care. And children of color are disproportionately affected by that. And then, of course, we cannot forget the children who are in our federal government's custody and being treated horrifically. So, as president, what actions would you take to ensure the safety and well-being of all the children living in the United States?
Yeah, and you hit about at least 3 different areas, right? The challenges of a child who's either abused through the system and into the foster system. The safety of children when it comes to guns, and then what's happening with the federal government ripping families apart. And that's, it's interesting in some respects. I'll step back again and then I'll go forward. Like when I was Attorney General, the state's chief law enforcement officer, but I created Children's Justice Center because we also have the criminal justice system is either going to further victimize a child or get them on the path to healing. So that was everything from drug-endangered children to how we actually do examinations of children and bringing both the social workers and law enforcement together and physical health so we're not further victimizing the child along the way. We started programs recognizing after-school providers and mentors because so often for a child, that's what's going to help him or her along the way, and that's actually part of the law enforcement issue altogether. I think that at the federal level, when we look at the services that we provide for our children, and again, the federal government can't do all of it, but it can provide some of the incentives for the states to move in better positions how we treat the victimization of children at every step. And it's state law that decides when you're going to do a family separation or what can happen, but the federal government is the backstop that can help define a lot of those areas. And I think that's another reason why that we need to be investing for the resiliency of children along the way for whatever's happened to them. That's why we're trying to take the good behavior games all across. When it comes to, it so struck me when my 6th grader, even as an example, had to learn about the first week of school, where to go in case of an active shooter. And let's hope an active shooting never happens in any of our schools. But just the trauma that's impacted by this is what you learn your first week of school. I think we can take better steps and more sensible steps when it comes to keeping our kids and our communities and our families safe. The vast majority of Democrats and Republicans and NRA members think we should have universal background checks to try to keep guns out of the wrong hands. We need to get to safe storage laws because part of what happens in a lot of our, especially in our schools, is when a youth has access to firearms. Red flag laws, the ability to remove a gun where through a court process where we see signs of challenges. And finally, places like Dick's and Walmart no longer sell assault weapons. They're not used for hunting. There's no reason that we continue to sell them. I think it's going to take a lot more in Washington, D.C., though, on that. And that's where folks like you and gun owners stepping up and saying, I've never met a gun owner, and I'm a hunter, that never met a gun owner that doesn't want to keep their kids and family and community safe as well. The atrocities that's been happening at the border directly with children, I think we have some bureaucracy challenges with our overall immigration system, and we have to get to a point of comprehensive immigration reform. But the biggest challenge in some respects is this president, because he is using immigration not only rip communities apart, but rip our country apart. He's taking a law that's been in place for 90 years and choosing to use that law to rip families apart. So I think the biggest thing first we can do is change the president. Second, you have a broken system in many respects when you have 450 judges for a caseload of 950,000. And you've exacerbated the challenges on the border by actually taking money away from the Northern Triangle countries as opposed to trying to provide for their economic self-sufficiency. And then I think that we need to get comprehensive immigration reform, which would include a path to citizenship for those without documentation in this country, immediate protection of the dreamers, and set some real standards along the way.
Next, we'll talk about family economic security, and I'll turn it over to Lana.
Thank you. Good morning.
Good morning, Matt.
I'm Lana Shope with Iowa Community Action Association and Iowa Head Start Association. In Iowa, we have 17 community action agencies that serve all 99 counties. There are over 1,000 local community action agencies all across the country. We primarily serve individuals and families that have low and limited income. Most of the people who receive services from us are at or below 100% of poverty. We know that kids do better when families do better, so we're very concerned about the economic security of families. So as president, what would you do to ensure that families are able to meet their most basic needs and to invest in the future of their children?
Yeah. You know, even long before I got into public office, it was interesting. Our minimum wage was $5.15 an hour. Died on a 50-50 vote in our state legislature to increase it. And a legislator said, oh, good, now I don't have to lay off a bunch of high school kids. You know, not recognizing the vast majority of minimum wage earners are actually single parent head of households that are working 2 and 3 jobs just to get by. So at that time, I formed a group called Raise Montana, and by ballot initiative, we increased the minimum wage, tied it to inflation. And overwhelming support in the state, right? And I think that there is overwhelming support for turning around and saying that, and a minimum wage isn't a living wage, you know, that we're now at, I think, $8.50 an hour. Well, that's still not a living wage by any measure. So I do think that we should nationally increase the minimum wage and increase it substantially, but that's still not going to be enough. There are some things that we can do, even stepping aside from overall economic security. Like, we've really pushed breakfast in the classroom and trying to make sure that kids in our schools, that their food insecurity needs are met, because you have about 20% of kids in this country that are food insecure. And that's an easy thing where the federal government actually has the money to help take care of this if we can ever get the local partners along the way. We're in a time where, and I understand why there's frustration. If you think of 60% of Americans haven't had a real pay increase in 40 years. So you're working harder and you're actually making less money than you were 40 years ago. And that's not, if you have a cute little one like that, right? There is no ability from the federal government or otherwise for paid family leave to take care of that child from the beginning, which is another thing that we've proposed. But we have to try to turn around and say, from an economic security standpoint, of a minimum wage is enough. It needs to be substantially increased. Then we have to look at where are the opportunities to be investing in our communities, urban and rural, because to invest in individuals to climb that economic ladder. And it really has changed over the last 4 decades. And then you have an urban-rural disconnect that really exists as well. When you're losing businesses in your rural areas, it's that much harder to sustain. So I think that we do have to look at, and this is everything from how we approach trade deals to how we approach incentivizing companies to do the right things. When I say that, you can expense a piece of equipment in 1 year, but there are no incentives to invest in your employees, in training and educating them along the way. I think that we all have to recognize that not everyone's going to go to college. 68% of people in this country don't. And we don't talk enough about what the path is for them. Like, we've made our 2-year colleges and our tribal colleges about apprenticeships and certificates, so people can learn at their own, around their own schedules and actually climb the path into the middle class. So there are no easy answers for this. There are base income supports, and there ought to be expectations of salary. There ought to be, and I've proposed a federal earned income tax credit. What we did in Montana took us 20 years to get there.
Really?
Yeah. All of those will help, and then we have to make sure that we have the social services around it as well.
Thank you.
Thank you.
And lastly, I'll turn it over to Sheila Hansen to ask about equal opportunity.
Well, I'm the last question, so your knees will get a break here in just a second. I'm going to talk a little bit about equal opportunity, and the face of the nation is changing, and Iowa is also changing, and children are leading the way. And quite frankly, we have many families with young children who are afraid today if they don't look like the average white person in our state and in our nation. And so my question is kind of a long one. It says, as president, what actions would you take to ensure that all children have equal opportunities and to end discrimination and disparities on the basis of race, ethnicity, gender expression, orientation, ability, class, and citizenship status?
Yeah, and I think to your point exactly, Sheila, and it's not even just the changing Iowa, right? Every child ought to feel both safe in their communities, in their schools, no matter where they're from or who they might love, or as they're finding their gender identities along the way. And I think that the federal government has a significant role to be able to play in incentivizing the proper actions. That in part is what the U.S. Department of Education does and should do. Full funding for Individuals with Disabilities Education Act, which has never actually occurred. Where you take some of this money, I propose to double the money that we're spending at the federal level in the Department of Education, because so much of that goes down also through into Title I programs and helping those that are most disadvantaged. And unfortunately, often the disadvantages, it's not just economic disadvantage, it's our racially disadvantaged communities as well. And a broader step, too, in stepping back, that we have to get to the point, and there are a couple federal proposals. Essentially, it's both equality proposals and anti-bullying proposals. I mean, we finally, in Montana, we were one of the last states to pass an anti-bullying law and make requirements throughout our school districts. There's a piece that's moral leadership, too, and what we've seen is this president really is using race and gender to divide this country, and gender identity to divide this country. So I think setting a different tone as a president is part of this, but it's also looking at the structures along the way, because that's everything from, that when we look at our youth homeless population, LGBTQ youth are much, much more even apt to be homeless. But part of that's family supports, part of it is the supports that we provide as a community along the way. I want to create that place where it is safe for every child growing up, first of all. But second of all, it's more than safe that one isn't viewed differently because of who they love or the color of their skin.
Thank you.
Well, we know here in Iowa, and people across the country know, that these issues are important, and they are issues that people will be voting on in this election. We did a poll back in May with Ann Selzer and company that shows that 80% of Iowans view the safety, education, and well-being of children as the highest priority for the next president to address. And that beat out all other issues, including jobs in the economy, balancing the budget, climate, immigration. So we do need to make these issues a priority, and we're really looking forward to watching you as you continue on the campaign trail, talking about kids and families. And we'll be there to ask you questions along the way.
As you have in the past,
yes,
which is
absolutely.
good. Yeah.
So So I'd like to give you the opportunity to say any additional comments, and we will wrap up and have the opportunity to tour this wonderful center here that's doing work on the ground here in Iowa, and to learn about what they're doing and the issues that they're facing here.
Sounds great, and I appreciate you all doing this for all of the candidates and to raise the issues because it is so significant. Unfortunately, that little one doesn't have a lobbyist, right? And
Well, we tried.
yeah, yeah. Well, and for far too often, the voices aren't heard because of, in a system that unfortunately, like you have Lindsey Graham literally saying we have to get this tax cut through to make our donors happy, and 60 Fortune 500 companies pay less in taxes than whoever cleans this place this evening at a time where often when we talk about the challenges of income inequality and other, it really has been said because those voices aren't heard enough. I do appreciate you all doing this, and I also appreciate the role that Iowans take in this process. I mean, I think I add a lot to this overall. Only one in the field to actually have won in a state where Donald Trump won. And we all leave come February. All these candidates do. And a third of your state actually voted Obama, Trump, a third of your counties. And you need to get back your state legislature as well. So we can talk about the investments that are being made in Medicaid or in income security. I think I can add a lot in that respect. I also think, I've worked my whole time with a legislature that's more Republican than yours in Iowa. Yet the sort of issues that you focus on, that you try to move forward, we've actually had significant progress because the well-being of a child shouldn't ever be a partisan issue. But it does take significant federal investments along the way. So there's 143 days before you all make decisions, and I appreciate you both taking that seriously, pushing the candidates on where they can go, and look forward to seeing you all along this path.
Okay.
Thanks.
Thank
Thank
you.
you.
Thanks.
Thank you very much.
Thank you.
Yeah, thank you, Governor Bullock. Thank you to all of our advocates here today, and thank you to New Horizons Academy for hosting us. And we'll see you soon, I'm sure.
Sounds great.
Thank you.
Thank you.